Good afternoon from the volcano. Little Luigi and I are going to bring you another update and some information. That's right, I named the chicken Luigi because I freed Luigi. He was the only little dark chicken in the middle of all of these yellow meat chicken babies. And I know what was going to happen to him, and he didn't belong there. So I got him and I brought him home with 4 other little brown egg laying babies that we bought the same day. But I freed Luigi, and he's grateful. So anyhow, I am going to sit here with a glass of my Camito tea. It's so good. I really like this stuff. I'm going to show you how to make it one day. I also evidently take a bath in it because I just spilled it all over me, but that's okay. But today I'm going to talk to you about some of the issues that animal owners might face in Costa Rica, some of the parasite issues and the disease issues that are sort of endemic to Costa Rica or Central America that we don't deal with as much in the U.S. I'm going to talk to you about some of the things with our dogs and the horse and some things I faced with the pigs and the goat and what I'm doing about it. I'm also going to share a little bit of my own experiences with health and some of the stuff that I have dealt with. There's a lot of talk about healthcare right now, and to be quite honest, that's one of the top reasons I landed in Costa Rica. Among other things, there's overreach and all of that, and underperformance, with our tax dollars. I do have a disability. I have a pretty pronounced disability, and could not afford the Medicare. Like, you have to pay so much a year. It's just regular insurance that you have to pay. I couldn't afford to go to the doctor, and I had Medicare. So I had to do something about that. And, people think you come to Costa Rica to live large, and I came to Costa Rica to live smaller because I couldn't afford to do it the U.S. way. But anyway, if people don't want to hear me going on about my health, I'm going to try to break this video into chapters. So if you don't want to hear about that, if you only want to hear about the animal stuff, this is a mouthy one. If you only want to hear about the animal stuff, and then I have an update about us trying to get the campground going and get the little village here that we have with friends going, I'm going to do chapters with links below. So if there's something that you don't want to hear me rambling on about, just skip it and go to the other part. So running the sanctuary here, we have 20 dogs. We have several cats. We have 3 pigs, a goat, 2 parrots, a bunch of chickens, and we have a horse. And the funny thing about when you deal with rescue animals, so even though we're not a rescue, that's all we deal with are rescue animals. We don't get animals for fun. When you deal with rescue animals, you deal with animals who come to you sometimes with health challenges. And Ehrlichia is a disease. It's tick-borne. It creates symptoms kind of like maybe Lyme disease. It's a different disease than Lyme. I'd heard of it in the U.S., and there's a 4-way little antibody test that can be done in office in the U.S. by veterinarians that tests for it. So I knew what it was, but in all my years of rescue, I'd never dealt with it. I'd never had one test positive. Here, every dog I took to the vet tested positive for Ehrlichia. Even dogs who came here and I know they were negative. And yeah, there's ticks around and we've had some tick problems, but this disease process was a new thing for me, and there was a learning curve. And I'm here to tell you, as somebody with decades of experience with animals and rescued animals, this is next level nightmare fuel stuff, because the things that we did, I'm going to have to put mouth down. He's right in my ear. The things that we did with rescue animals in the U.S. don't even begin to deal with the problems here. I mean, you give your dogs NexGard or Bravecto, and yay, they're tick and flea free, and it does cure mange mites, and you think you're okay. But see, here's what people don't think about, and I didn't think about it. Those medications are systemic. and the flea or the tick actually has to bite the dog to ingest the toxin and die. And once they bite the dog, they've already transmitted the disease, even though they die however many minutes or hours later. The ticks or fleas, not the dog. But anyway, they have to actually bite the dog. Well, that's a problem here in Costa Rica when you have almost every tick is carrying this bacteria. So I was shocked and appalled. I'm like, my dogs don't have ticks, my dogs don't have fleas. And of course, we have had to deal with that. And bot flies and all of that. And I'm not going to upload images here. If you're really curious about what a bot fly maggot looks like in a dog or a person, because they get in people too, Google it. I'm not going to traumatize my viewers. It's yuck. So I was thinking that we had this under control and we had a way to handle it, but clearly not, because then I had some dogs getting symptomatic from Ehrlichia, and Ehrlichia can, over time, kill them. You have to treat it. You can't just ignore it and hope it goes away. Some dogs do clear it out of their system on their own. A lot of dogs do not, and I had some sick dogs. When we went to the vet, and I got an education about Ehrlichia. I'm not going to be using NexGard, Bravecto, and those types of flea and tick control anymore, unless I have mange. Now they're good to treat like mange mites. Yes, yeah. But as far as flea and tick control, it's it works, but then you kind of are open to a lot of new problems. So I'm kind of going backward a little. This is fipronil. It's like what's in the front line and treatments and topical treatments, and they've gotten resistant to it. Fleas and ticks both. But it's a repellent, and it will keep the bites from happening. So I'm spraying the dogs, spraying the horse, spraying everything. I'm spraying. I won't tell you that I sprayed me. I don't think that's for people. But if it's going to keep the fleas and ticks off of them to prevent a bite, then that's what we're going to do. But my frontline chemical medication of choice for the dogs, the horses, the pigs, the goat is good old ivermectin. And I don't know if you can see this. This is 1% solution. This is a Costa Rican equivalent of Ivomec. Now, Ivomec is what we use in the U.S. for goat drenches and cattle and that. It's not really what you use for horses or dogs. You know, knee-jerk reaction, you grab the big paste dewormers for horses, which is the same thing. Zimectrin is this. And dogs, you don't, I don't even know if you can get like ivermectin especially made for dogs, because it can be very dangerous for dogs. So overall, it's safe. It's safe enough for me to take. I actually take this. I take it myself. I'm not going to disclose the dosing schedule or the dosing amount or the regimen, because I'm not a healthcare provider, or, I'm not a healthcare professional anymore. I used to be. I'm not now. I'm not going to dispense medical advice, but I will disclose my own personal thing. I use this instead of methotrexate, methotrexate is a chemotherapy drug that keeps rheumatoid arthritis and other autoimmune diseases like lupus under control. It just keeps it sort of knocks your immune system back, so your body's not fighting itself. So I'm not going to tell you the way that I do ivermectin for myself, but I am going to tell you what I do for my dogs. And again, I'm not dispensing veterinary advice because I'm not a veterinarian, but I'm going to tell you some things about it, because there is a very high potential using this product right here, and more people are going to this because they're hearing about it. There's a high potential to overdose your dog, and that is not what you want to do. So anyway, this contains this liquid suspension. This is 3 mils. It's full. All the way to the stopper is full of this product. This is what I would use to treat like a 300-pound goat. usually the recommendation, and this is dispensed by the agriculture place where you buy it. It's not veterinary only knowledge. You can find it on the internet. For like a goat would be 1 milligram of product per 50 kilograms. So if you have a 300-pound goat, that's roughly 150 kilograms. It's not exact, and it doesn't have to be exactly exact for like a goat, but this is what I would give a goat. Okay, so you think, all right, so I have a 15-kilogram dog. A dog, 15 kilograms is not exactly 30 pounds. It's not an exact double conversion, but 15, we're going with kilograms. I'm going to stick with kilograms here. If you research the dosage for ivermectin for dogs, you're going to find 0.2 milligrams per kilogram for a dog. But they're not talking about this. Okay? So listen up, guys. Each milligram of this has 10 milligrams or each milliliter of this has 10 milligrams of active ingredient of ivermectin. So you say, all right, I have a 15-kilogram dog. 15 times 0.2 is 3 milliliters. Oh, so I have to give my dog 3 milliliters of ivermectin. You will kill your dog. Okay, listen to me. Don't calculate it that way. There's micrograms and units of measurement. That's just the 3 milligrams of ivermectin for a dog using this product is, I don't know if you can see the 0.5 right there. It's like you would give that much to your dog. And that's a high dose because that's the skin parasite dose. The heartworm maintenance dose is much, much lower. And I'm not even going to talk to you about the gene mutations in herding breeds that can't have ivermectin at all. If you're going to be dosing your dogs, you need to be doing your own research. So maybe the biggest adjustment that I've had to make in the anti-parasitic measures I've had to take with ivermectin is the frequency. When I was in the US, I would deworm horses and dogs like every 6 months. Here, I'm doing it as frequently as once a week. And not all the time. I mean, sometimes I'll stretch it out to 14 days or whatever, because ivermectin will stay in the system for a little while and you'll have some it'll taper off how effective it is at killing the bugs that bite them or whatever. And remember, I'm also using the preventative, which keeps the ticks from getting on them in the first place. So it's just it's a multi-front attack on this. But I know that it is safe to do it at this frequency because not only is the frequency that I take it for rheumatoid arthritis and the inflammation of lupus and that sort of thing is it's pretty frequent. There's also, and the reason I'm hesitating is because I don't want to be dispensing health advice. You're not going to walk away from this video feeling like you've got a head full of knowledge about this stuff. I want you to walk away from this video ready to go and research and do your own research, peer-reviewed journal articles and that sort of thing. Do your own research. Don't depend on me to get it right. I'm just telling you to go look. But ivermectin, fitbendazole, a lot of these dewormers are being used to treat cancer, and they're being used experimentally in some cases with very impressive results. Especially in animals, they're being used in the veterinary field. I do know some veterinarians who, not personally know them, but I know of some veterinarians who are using this in their practice quite frequently, and they are dosing them every day with high dose of ivermectin and sometimes fenbendazole, and they're getting results. They're getting cancer cell death, and they're getting healthy cells to consume the cancer cells. Apoptosis is one, and I don't know all the terms, but anyway, you can look it up and find it for yourself. So I know that dosing the animals on this frequency is not going to hurt them. I just don't want to overdose them all at once. And that's the point I'm trying to make. If you're in Costa Rica or Central America and you have animals, you need to be thinking about Ehrlichia with the dogs. You need to be thinking about anaplasmosis with the horses and equine infectious anemia and that sort of thing. These diseases do exist in other parts of the world, but here they're, wow. I mean, it's a very big deal. And I am going to talk to you a little bit about the symptoms of these diseases so that you can know what to look for in your animals. What I noticed first when we first started having a problem with the Ehrlichia and the dogs was that some of them were losing weight. And since these dogs are dewormed regularly, more than regularly, and they eat well, I knew something was wrong. And those dogs that were losing the weight also became a little more lethargic and they slept a lot. And then I noticed that they had a cough. And I'm thinking, oh God, no, not, heartworm, because sometimes heartworm can cause a dry cough. So I'm thinking, that. And then the next symptom that I noticed, and this was all in pretty rapid succession, like within a day or two, is a couple of them started having weepy eyes and like eye boogers and things around their eyes. Their eyes were, it was like they had a cold or the flu. And I said, this is not okay. So off we go to the vet, and she does the in-office antibody test. It's the little, I don't know if it's so I've heard them called snap tests. I don't know if that's right, but they take a blood draw, a small blood draw from the front leg of the dog, and they stick it on a slide. It's this little mirror. They stick it on a slide, and within just a minute or two, it'll show up. And everything I took was positive. Every dog I had was positive. And so she, realizes that I have a lot of dogs here. And so she's sort of freaking out and I'm sort of freaking out. So that was the story with our dogs. And we treated them with doxycycline. It's like a 28-day regimen with doxycycline. And then there is another injection of medication. Imidacarb is what it's called here. It works a little bit too. I would consult a vet about that. I wouldn't just go grab it and start dosing dogs. But anyway, we did that. And some other medications she gave them to protect their internal organs, their liver and whatnot. Because the one thing about Ehrlichia is that you have several stages of infection. You have the acute phase where they're going to run a fever and be coughy and sneezy and lethargic and have an upset tummy and all of that. But sometimes those symptoms will clear up, but the Ehrlichia doesn't clear up. So you have what appears to be a healthy dog who's harboring this bacteria, and it's destroying their organs as you go. And then later they'll start having chronic symptoms, and that's a lot harder to treat than when you catch it in the acute phase like we did. So anyway, if you start, even if your dog is symptomatic or not symptomatic, if you live in Costa Rica, take your dog to the vet and have a test done for Ehrlichia just across the board. At the very worst case scenario, that's wrong. In the very best case scenario, if it comes back that your dog is negative for everything, at least you have a baseline so that you will know if your dog ever does test positive, you will have a baseline there so that you can kind of have an idea of when it started. So for you horse owners in Costa Rica, there's the equine infectious anemia. And I won't go into too much depth about that because you probably already know about it. Horses can be completely asymptomatic with EIA. But the problem with that is that they're still silent carriers. They'll have it for the rest of their life. There's no cure, no treatment for it. And even though that horse may be completely asymptomatic, if you put them in the pasture with other horses, every horse in the herd is going to get it. And you got to make a tough decision. Do you want to keep your horse isolated for the rest of its life? Or do you want to have it put down? I can't even imagine having to make that decision. But that's the case. You don't need to ever put your horse in the pasture with another horse. Do your own research about this. Don't count on me to give you the best information. Just know that this exists and research it. There's plenty of information online. Now, the horse that we took into rescue was a rescue before she came here. She was rescued from a starvation situation and put out on a large pasture with good grass, and she was able to graze and gain some weight back. But for people who haven't been around horses a lot and don't really understand, a lot of the more subtle signs and symptoms can kind of get past them. And that's what happened in this case. Nobody neglected her. It wasn't intentional. But when she came to us, I noticed the first day she arrived that her legs were swollen and she was not wanting to move around. She was sore. They'd ridden her over here and she was kind of suffering. So I put her out in the pasture, let her graze. And so she was out with a face full of grass every day. She didn't really gain weight. She didn't really lose weight. I noticed that her top line was atrophied. The muscles were atrophied away from her backbone and her hips, and her croup area just didn't look right. I'm thinking, well, maybe she just needs, time and good nutrition. So of course, we dewormed the heck out of her, and she was covered in ticks. And so we got rid of all of those with the ivermectin and the fipronil spray and just pulling them off, and got all of that off of her. And it's hard to keep them off because there's ticks everywhere here. I mean, there's just ticks everywhere. She goes out in the pasture, she comes back and ticks again. And then, of course, it's La Nina, and all we're getting is rain, and it's rain and rain. And yes, she has somewhere to go to get out of the rain. But if I locked her in the barn and didn't let her out to graze, y'all would fuss about that too. So she's out in the rain some, and she got this awful case of rain rot, rain scald, and I couldn't clear it up. And I know how to clear up rain rot. And so I'm thinking to myself, no, there's something else going on with this horse. Sure enough, turns out she has anaplasmosis, which is similar to Ehrlichia in dogs. It's the horse version, maybe. I don't know if that's right, but just to simplify it, just look at it that way. So now we have a horse with the same type of tick-borne disease, which is, got symptoms of rheumatic symptoms, that she's got painful, swollen joints. She's got muscle atrophy across the top line. She's maybe got some neurological stuff going on. I got some videos of her, first and second shoeing. Now, we don't ride this mare. Like, she's not ridden. She's not worked. We had Michel ride her to test her gait under saddle and see how she did and compensated. And it told us a lot. I have a lot of the traditional inflammatory symptoms with rheumatoid arthritis, like the swollen joints and the achiness and just the normal stuff. But from the inflammation that went untreated for more than 15 years, thank you, U.S. healthcare. I kept being told that I was fine. I knew something was wrong, but I was fine. So for more than 15 years, I was suffering with symptoms that gradually got worse. And a lot of my symptoms were neurological. So I have to assume that my peripheral nervous system was targeted by my immune system, and I have some nerve damage. The biggest thing for me is autonomic dysregulation, POTS. I was tilt-tabled and all of that. So many years ago, this is absolutely confirmed. It's not just me talking off my head. I'm disabled because of it, received a disability because of it. And a lot of my videos, I'm sitting here. You'll rarely see me up moving around because I have mobility issues. And I think a lot of people may not realize that. I fall down at least once a week. I mean, some way I'm going to figure out how to fall down, whether I get dizzy and fall down or can't feel my feet and fall down. But I have a lot of nerve pain. I have central apnea. I have to use a CPAP at night to help keep air blowing down my throat because I'll just stop breathing. And I have several things that are going on with this. And it's a problem. So I hope I can be an encouragement maybe to people who get these diagnoses, that even when some of the symptoms can be severe, you can still have a good quality of life. You just have to make a lot of adjustments. Now, I take a lot of cardiac medications. I take an alpha blocker, a beta blocker, and a calcium channel blocker. Let me try that again. I take an alpha blocker, a beta blocker, and a calcium channel blocker. There you go. I also take a drug for kind of a neuromediator drug to try to help with some of the neurological symptoms, and it does. If I miss any of these doses, miss any of these medications, I can tell the difference. I'd love to be able to come off all of them, but I can't. I mean, when you're taking a cardiac drug that regulates your heart rate and keeps your blood pressure from going up to like 260 over 120, you got to take those meds. This is my life. I've already had one heart attack. I can't afford to just experiment with all these different, I've got to take what works. And I do. And then I take a lot of turmeric. Turmeric, ginger. I drink the not commodity, good grief, the Kamito tea every day. And so I do my very best to take care of myself. But when I talk about taking the ivermectin, understand that I've consulted with doctor about this, and I've consulted with my pharmacist here in Costa Rica about this. I'm not just cowboying it. Do I believe ivermectin cured COVID patients? I don't know. That's not what this video is about. It may have. I know it's a very strong anti-inflammatory and works on the cytokine response and all of that. And so it may have. I'm not, but I will tell you this, I'm not a doubter when it comes to the literature that's coming out about cancer treatments and whatnot. It's a very potent medication. And I just invite all of you who are having these issues, do some study on it, do some research, because a lot of information about drugs like this are being withheld from us. Free Luigi. The last thing I can give an update about is how we're progressing on the campground and public avenue of what we're doing, where we can at some point welcome guests. And we've had people come to visit us, people that I've met, in Costa Rica and online or whatever, and we just can't properly entertain guests here right now. You can't even really come inside because we got dogs everywhere. The dogs will jump on you, and people don't typically like that. They don't like having mud on their clothes and whatnot, but we want to do that. We eventually want to get to a point where we can open the gates and let people come and walk around, but it's going to take some planning and some construction. We've got to do walking trails and fix things up and whatnot. So it's going to be a process. Just know that's in the plans for the future. If you want to come visit us now, by all means, come out here. But most of the time, we don't even have a chair for folks to sit in. I mean, it's like we ain't ready. But the dogs are here if you want to come meet them. We're not hiding them. They're out by the road. You can drive by and see them. So our friend Corky has also decided to move here to the mountain, and he's got a bus that he's going to convert into a kind of a tiny home. And I want to tell you this little story because if you live in Costa Rica already and you've done these things, you'll probably share a chuckle with us at our expense, maybe, but I don't care. If you don't live in Costa Rica and you haven't really been here other than on a vacation, you may not understand the culture and how difficult it can be to get things done well or right. But we hired a backhoe, come in here and put culverts in at Corky's driveway because we're going to be moving a humongous bus in here. It's 12, 14 meters. I'm not sure. It's a big one. It's a big bus. And it's going to be attached to a big tow truck, the big commercial vehicle kind not the little bitty. I mean, it's going to be a big ordeal getting it here. It's going to be a very costly, very probably traumatic experience to get the bus here. But one of the important things is that, first of all, we get so much rainfall, we have to have big culverts, not little bitty pipes like you see in North America. We have to have big culverts, concrete culverts, but they've got to be countersunk to a certain point because the weight of the bus combined with the tow truck backing over that, you're going to collapse stuff. And I tried to communicate this to the Backhoe company, who has a very professional appearance. They have good optics. When you look at their ads and you look at the things, they look like a very professional company. But this guy that came out with the Backhoe, and I'm not telling who they are either, not because we kind of, we didn't pay them for this work because it wasn't the work we wanted. And they're not going to fight us, and I'm not going to shame them publicly, okay? I mean, it's just, we're not paying for crap work, and they can just, but at the same time, I'm not going to blast them on social media. We're not doing that. It's just over. But anyway, they came in here with the backhoe, and they dug this little trench, and they laid the concrete pipes in, and there's a big hump where he just piled up the dirt on top of the pipe rather than countersinking the pipe. And of course, I had explained, or had tried to explain, the point. The purpose of this exercise was to countersink it and put material. We even had a pile of substrate that was supposed to be packed in and around and on top of that pipe. And he had completely ignored it and just put mud around the pipe. It's a mess. I'm showing pictures here. I mean, it's just a mess. But you can see there's a big hump that by the time you pile substrate on top of the hump to distribute the weight of the, you're going to have a big hump, and that back end of that bus ain't going across it. So essentially what we've got is a mess, for one thing, but we have a culvert installation that we cannot use for the purpose for which it was intended. And I was standing right there. So sure, you don't hire people and then go back to the US and expect to come back and your work be done right. That doesn't happen in Costa Rica. You got to babysit them, folks. You really do. But I did. I was standing right there, and I was the one, we were the ones, Michelle and I were, we were paying the backhoe company to do this. And the company's logic was, well, we don't listen to, the guy with the backhoe driver has to do what the man in the field tells him. We were in the field, and I'm sorry I'm not a man. I might be a female, and they might have not wanted to take operating instructions from me. I get that a lot here in Costa Rica, but just a word to the wise. You don't just have to babysit them. I mean, you really gotta watch what goes on. And we're not paying for this work. The stuff you're seeing on the screen that I'm showing. Yes, it's a culvert. Yes, it's installed. Eventually you'll be able to drive a car over it. But for us to put the bus onto this lot, this ain't gonna work. I mean, we're going to, and just think about it this way. If this guy comes in here with this big tow truck and he backs over that and his back wheels collapse and go into the ditch and he's sitting on the frame of his vehicle, well, guess who's going to have to pay to clean that mess up? So it's just a way that people here they're not really trained and taught to think about all of the possible scenarios that could happen. They're told to do a job and they go do it, and it's just not a lot of thought goes into it. And so that's just our little story about what happened. So if you're planning to come here and do work or whatever, just glean what you can from it and know that even when you're aware of the problem, even when you stand there to try to babysit, they get angry at you. The man when I tried to tell him what was going on, I ended up yelling at him, which is what you are told not to do in Costa Rica. But at that point, I didn't care. I wanted him to stop before he made it any worse. He was making a huge mess. But I tried to be nice to start with, but I guess because I'm female, I don't know. Whatever. But he didn't listen to me. And he told his boss he didn't listen to me. And I was right there. We were the ones with the money. The ones with the money are the ones who are supposed to be able to tell you how the work is supposed to be done. You're going to encounter stuff like this, and you're going to encounter these kind of crusty old guys who won't listen. especially if you're a woman. They don't want to listen to you. And now we have a mess. We did not pay for the work. We're not going to pay for the work, but we've got to pay to have it cleaned up and redone and fixed so that we can get a huge bus in there and tow truck and all of that. But that's just a little Costa Rica story for you. It's just the way things are here. We'll get it right eventually, but that's holding us up. And all the rain, it's just raining here. Too wet to do anything. We can't grade the road into the campground, even if we had the money to do it. So anyway, we're waiting on rainy season to sort of abate and all of that. And progress. I don't even want to call mess in this ditch progress, but that's where we are. So anyway, laugh if you want to. I don't care. I've laughed and I've cried and kind of done it all. So it's all good. Pura vida. Until next time, we will see you then.